You're watching PCTV Channel 17, proudly serving the Port Clinton City School District community. The following is a production of the Port Clinton High School Digital Media class.
Welcome to Time for Health. I'm your host, Rachel Faw, and we're very glad you've joined us. We hope you gain something from the program that helps you and your loved ones. We want to arm everyone with as much information as possible so we can all make good choices. And this is not to take the place of regular medical care, so be sure to include your healthcare provider in on your plans and your conversations. And today our topic is more about the insurance aspect of it and all that fun stuff. And we have Julie Grasson with us. Thank you for being here.
Thank you for having me.
You've been here before talking about the same topic, sort of, but I'm sure things have changed, so I appreciate your time kind of updating us. We're going to talk about marketplace insurance, Medicare expansion in 30 minutes or less.
Bring it on.
Bring it on. So, marketplace insurance.
Yes.
This is from the Affordable Care Act. Some people call it Obamacare. Is that,
correct?
That's the right reference. Okay. So, who is it for? Who is it not for?
Pretty much anybody who's uninsured currently, if they have a household income between 100 and 400% of the poverty line, they would qualify for tax credits, which then helps reduce their monthly premium.
Okay.
If they have a household income below 250%, and they pick what's known as a silver level plan,
okay,
not only do they get those tax credits, but then they also qualify for cost sharing reduction, which reduces their total out-of-pocket expenses.
Okay. So this is for some people who are not insured.
Correct.
Okay. So if you have insurance through your employer, or if you are a Medicare recipient.
Medicare recipients don't have to do a thing with meeting with a navigator.
Okay.
Even if they're looking for help in terms of picking their provider,
okay,
or their carrier,
okay,
navigators cannot help with that.
Okay.
And the only people who have insurance through their employer who may be eligible is if they get a form from their employer that says the plan that they are provided through their employer is not affordable.
Okay.
So basically, if it's more than 9.5% of their income, that's deemed not affordable,
okay,
so then they could go through the marketplace.
Okay, okay. So uninsured mostly. Okay. And it's mandated? There's penalties if you don't enroll, and how does all that work?
There are penalties. Health coverage is mandated. So basically, if you go an entire year, if you go any part of the year beyond 3 months without insurance coverage,
okay,
you will have a tax penalty when you file your tax return the following year, following April.
Okay.
There are some exceptions to that. So if somebody's household income is low enough that they don't file tax returns, they're kind of exempt. But if that's the case, more than likely they would qualify for the Medicaid expansion, so they would have coverage.
Okay.
There are also a couple other areas that people may have what is known as an exemption from the marketplace or the mandate, and there's a complete list of those at healthcare.gov.
Okay.
But some of the most common ones are if somebody in the past 2 years has had significant medical bills, they can apply for an exemption.
Okay.
If they have had either a disconnect notice for utilities or an eviction notice in the past 6 months,
okay,
those would qualify for an exemption. So there's a very long list,
okay,
and navigators can certainly help people apply for those exemptions. And it's much better to do, much better, it is more beneficial to the individual to do it ahead of time instead of waiting till
sure,
tax season.
Okay.
Because it does take several weeks for those to be processed and for
Okay. them
to get their form through the mail.
So you mentioned navigators. You sound like nice people that can help you weed through all this. Is
Yes.
that okay?
All of the navigators have, when they first started, did a 20-hour training
Okay.
through the Center for Medicaid and Medicare Services. Those who are returning did do a condensed recertification version.
Okay.
And then in addition to that, all of our navigators are licensed through the Ohio Department of Insurance.
Okay.
So they've done the federal background check, the whole 9 yards. And what they're there for is truly to provide unbiased information.
So they're not representing a certain insurance company or anything like that?
No, none of the funding comes from insurance companies.
Okay.
and truly what individuals need to know is that, we're not going to say, yes, this carrier was great, this one, not so much.
Right.
And no navigator wants to know what somebody's health conditions are. But the nice thing with meeting with a navigator is, they'll ask you if you have chronic conditions that you see regular doctors for, or doctors on a regular basis for. They'll ask if you take maintenance medications, so that when they're meeting with you and you've gone all the way through, you figure out what your tax credits are, they will help you pick the plan that best meets your needs, making sure that the physicians you see are covered, making sure that the medications you take are covered, and laying all those options out.
Okay. So we're kind of covering just some basic information here. Nobody needs to become an expert from our 30 minutes today.
Oh, absolutely not.
But just kind of gathering general information, but they can sit down with a navigator and because there's lots of, like you said, is this provider on it? Do I see a doctor a lot, or do I very rarely go to the doctor? Am I on medication all the time? That kind of stuff. That they can help them work through that.
Definitely.
And kind of narrow down what the best choice is for them.
Mm-hmm.
Okay. And the penalty the first year, I know, was not very large, but it's kind of increasing.
Correct.
Mention about that.
The first year, so we are getting ready to go into our third year of open enrollment. The first year, the penalty was $95 or 1% of your income, and it's whatever was greater.
Okay.
So for 2015, any individual who's gone the entire year without coverage, their penalty is or 2% of their income, and it's whichever is greater.
Okay.
So coming 2016.
So if you don't sign up during this open enrollment for
Well,
next year, and then your tax season after that.
Right.
Okay.
So if people don't sign up this year and they go all of 2016 without coverage, their penalty will be 2.5%. Or $695 per person. And the thing to keep in mind is that it's whichever is greater.
Okay.
So, and unfortunately, there are some people that have said, that it's better to take the penalty. But the one thing that, to keep in mind is that it's just like car insurance. It's the law, it's required. But there's so many options out there in terms of different plans, different pricing, and it's not a one size fits all type.
Okay. Talk about the different levels. You mentioned a silver plan and that there's different.
They've broken it out where the lowest, coverage is through a catastrophic plan, which basically only provides 3 visits to the physician. It's only available to people under the age of 30.
Okay.
And it's truly for, I wouldn't even recommend it because there really is no coverage. They have huge deductibles.
Okay.
But then from there, it goes from a bronze all the way up to a platinum.
Okay.
The bronze, generally speaking, have higher deductibles and much lower premiums.
Okay.
And then all the way up to the platinum, which has higher premiums, which is that monthly payment that you make to have the coverage, but much lower deductibles.
Okay.
And as I stated earlier, with the silver plans, the nice thing is if somebody's below 250% of the poverty line, not only do they get the tax credits, which reduces their monthly premium, but they also get cost-sharing benefits, which are going to reduce their monthly or their total out-of-pocket expenses.
Okay. And again, a navigator can kind of weed through.
They can help explain it all based on.
Because they're within these different levels of plans, maybe just Aetna has a gold, a silver, a platinum, it has different ones. So it's not necessarily the insurance company, but these different, you want to look at the different levels first and see what kind of coverage you want. And then there might be multiple providers, multiple insurance companies that provide that level of plan.
Yes.
And then you can choose, there's that level of choice also.
Yes.
Okay.
Most definitely.
And that's
There's
why we
a
have
lot
navigators
of choices.
to kind of narrow that down. Okay. Are there networks and that kind of stuff in the insurance plans for all of them? Or?
Yes. Almost all of the plans definitely have their own network of physicians, their own network of hospitals.
Okay.
And the one thing to keep in mind is that definitely do your research. Unfortunately, the very first year we had individuals that, because you can apply over the phone by calling the marketplace, but there were people that had done that and didn't have all of the information.
And just kind of randomly
randomly picked one, and the one that sticks in mind, they lived in Findlay, picked a plan that only had hospital services down in Allen County. So they had a large commute in order to be able to utilize their services for something that was in network and covered by their plan. So really do the homework to make sure that the plan you're picking really meets your needs.
And we, the last episode of the show we did is also kind of an insurance one, just talking about general insurance, and then we talked about Medicare, but there's networks in lots of kinds of insurance, and so really doing your due diligence is my family doctor on there, is the pharmacy that I want to use on my prescription plan, is the lab that I use for my lab work.
The hospital I go to, yes.
So that's the information that an individual would need to bring to the navigator. I see my family physician twice a year, but I see a specialist, or I'm on maintenance medications. That's what they need to know.
Correct. And and to make it even a little bit more complicated, not that we want to do that, but in the world of the Affordable Care Act and Medicaid expansion, you may have one provider that has plans that are Medicaid, a plan that's on the marketplace, a plan that is private insurance through like an employer. And each one of those plans has a different set, or could potentially have a different set of providers in the whole 9 yards. So, if your neighbor has, insurance X, do you know for and you want to see the same doctor, but do you know if that provider, or is her coverage Medicaid? Is it private? Is it marketplace?
Yeah.
So the big thing that we encourage everybody to do is say, or to call their physician and say, do you accept insurance X on the marketplace?
Right.
Do you accept insurance X through Medicaid expansion?
That was one of the things they mentioned last time too, was you can't just say I have medical mutual insurance. I have medical mutual insurance through the hospital, or I have medical mutual through the marketplace, or I have medical mutual through Medicare. And you have to kind of really be specific when you're asking your provider.
Most
if
definitely.
They take it. You also mentioned open enrollment.
Yes.
So what is that all about?
Open enrollment, well, we're on our third year, so it's a third set of dates. Unfortunately, they have not remained consistent.
Yeah.
This year, open enrollment runs November 1st through January 31st of 2016.
Okay.
If individuals are currently uninsured and they sign up even November 1st, make their first month's premium payment, the whole 9 yards, their coverage will not start until January 1st. So anybody who signs up before December 15th, and pay their first month's premium, their coverage will start January 1st.
Okay.
If they sign up between December 16th and January 14th, their coverage will start February 1st.
Okay.
If somebody waits to the bitter end and the end of open enrollment, say January 31st, their coverage will not start till March 1st.
Okay. So that's why you say if you go the whole year without insurance, because depending on when you enroll, you still might enroll within the open enrollment period, but your insurance might not start till February or March.
Correct.
So, okay. What if somebody's situation changes? What if I have insurance through my employer that is affordable, but something happens, or I have something and it changes?
If you have coverage and you lose that and it's not during open enrollment, you have 60 days from the date that you lost that coverage to go into the marketplace and create your account, do all of the steps, and pick a plan. If you go beyond 60 days, you are now locked out.
Okay.
That's what's known as a qualifying event.
Okay.
So say I lived in Michigan and I had coverage through the marketplace and I moved to Ohio. My coverage through Michigan will no longer cover me here. I have 60 days from the point I move to sign up. Getting married, getting divorced, having a baby, losing coverage from your employer, losing coverage through Medicaid because you're now over income.
Okay.
All of those things are qualifying events, and individuals can get help through a navigator even beyond open enrollment.
Okay. Last question maybe about Marketplace. You can get it for dependents, your dependents, and I vaguely remember it's based on who your dependents are on your tax statement. Not because I say they're my dependent.
Household size and income is all based on
That's what it is.
your tax return.
Okay.
So if you have, if you're a grandparent raising 3 grandchildren and you claim them as dependents, your household, if you're married, your household size is 5.
Okay.
If you're not married, your household size is 4.
Okay. But if you're raising your grandkids but you don't claim them on your tax, it's all about your tax return.
Correct.
Okay. So if somebody, I knew it wasn't the last question about the marketplace. If somebody isn't going to meet with the navigator, do they need to, if at all possible, bring that last tax return just as proof of how many, your household size and all that kind of stuff?
Excuse me, yes.
Okay.
Tax returns are helpful when you meet with the navigator. The more information you can bring, the better.
Okay. All right. And like we said, who your doctors are, who your pharmacy is, who your hospital, all that kind of stuff. Okay. We're going to take a break and we'll be right back. Talking with Julie about Marketplace and Medicaid expansion. We talked about it being open enrollment time, and I know I help people with Medicare Part D stuff, just this little tiny piece of the insurance world. And in that particular case, it behooves people to look every year because things tend to change, sometimes pretty dramatically from year to year in the same plan. Is it the same with the Marketplace? Would you err on the side of look at it, re-enroll, talk to a navigator every year?
It definitely will not hurt to review plans. When people go in and create their account, they can select that, they want the Marketplace just to renew them each year.
Okay.
However, plans tend to change. Physicians come on and off of plans. So if you're not going in there and making sure that the plan you're renewing into is really what you want, it could be problemsome later down.
Okay. So you want to probably meet with a navigator every year just to look at what you have and see.
Most definitely. You don't have to change anything if you don't want to.
Okay.
But it definitely helps to know what your options are.
Okay.
There's always new plans, new coverage areas, I guess,
Okay.
in terms of expenses and different deductibles and.
Okay, so it doesn't hurt to do that. About the same time that this came out, or maybe it's the exact same time, Medicaid expanded their guidelines to catch more people and provide insurance through the Medicaid program. Talk
Correct.
about what Medicaid is, how it's different than the Marketplace.
Medicaid in the state of Ohio did expand. It is now for anybody with a household income at or below 138% of poverty.
Okay.
So basically what that converts to is for a single person, they could make roughly about a little over $16,000
Okay.
a year and still qualify.
Okay.
The big thing with Medicaid though is that it's another one of those things that you still have to recertify every year.
Okay.
The biggest note or push to have out there is that if you move, notify your county job and family services, because you will get a renewal packet in the mail roughly 2 months before it's time to recertify.
Okay.
If you move, none of that mail from Medicaid is going to be transferred.
Okay, so you could jeopardize your coverage if you don't let them know where you are, so you
Exactly.
can get your new stuff.
Exactly. So
Okay.
that's the big push.
Now, I know this was in the past, but the expansion was coming, and when the Marketplace was coming, people had to buy for Medicaid. Is Medicaid something you renew every month, or you have to recertify each month, or is it just annually?
It's just annually.
Okay.
And, some of where the confusion comes in was Medicaid expansion started, oh heavens, in 2013.
Okay.
When people certified, there was so much change happening that year 2 they didn't have to recertify. The state was given a buy.
So everybody gets a break. You don't
Everybody
have
had a break.
If you have it in 2013, you're good for
Right.
2014. Okay.
However, this year is when, so starting in January of this year is when people had to recertify.
Okay.
And over the course of 2 years, people may very well have moved, if not once, several times. So they didn't get their recertifications. There was, people may be aware of the lawsuit that happened because people were being auto-closed. The thing to keep in mind, though, is that those people that were affected, or the lawsuit only impacted those who were auto-closed between January and March. So those people had to be put back on. However, they then still had to recertify.
Okay.
But every month people continue to auto-close. So the biggest thing for people to know or to be proactive with is to call their Job and Family Services, find out what their renewal date is, and make plans to update your information with Job and Family Services. And especially if you move, provide that information.
And can a navigator help with that as well, with the Medicaid expansion, at least the initial application?
They can help with all of it.
Okay.
So they can help if somebody is new to the area or now qualifies for Medicaid, whatever, they can help them file an application.
Okay.
If it's time for somebody to recertify, a navigator can help them with that. CareNet worked very close with the Lucas County Job and Family Services, created a one-page renewal form, and which is much easier to do than a 14-page renewal packet from the state. But all of the Job and Family Service offices across the state, for the most part, all you have to do is write down on a sheet of paper, I want to recertify, and turn that in.
Okay.
You don't necessarily have to complete the huge packet. You have to make that contact, though, because otherwise, if you don't, it stops the process.
Okay. And do the navigators have computers? Because that might be an issue for people, too. A lot of this can be done online to kind of make it go faster, but if you don't have a computer.
Navigators have a complete mobile office, so they're coming with their laptop, printer, scanner, internet access, cell phone. So anything that they need to assist you with, they have. And like I said earlier, the more information somebody brings, the better equipped the navigator is to help you. Because with the scanner, they can upload any documents. They can upload, your photo ID, exactly. Which helps expedite the process.
Okay. And then every year, again, for Medicaid, they need to recertify, just as you would maybe recommend for Marketplace. Doesn't hurt to look.
Most definitely.
I mean, the easy thing to do is, I have insurance, I'm just going to leave it, but at least maybe every couple years you might want to look, because like you said, things change. Doctors come on, labs come on, come off. Your medications change.
And there's so many providers or managed care companies now with Medicaid. So if it hasn't worked for you in the previous year, reevaluate and look at your options
in the future. So when somebody's going to meet with a navigator, a tax statement, what should they bring? What homework should they do ahead of time?
The biggest things to bring are photo IDs, verification of who you are, income verification. And then if you are in a household, if any of those members of your household have health coverage, bring that information, because when you're doing Marketplace, you have to verify that somebody has coverage that's in your house. But the more you bring, so just come prepared. Photo ID, verification of income, last year's tax return, other carrier health coverage options, all of that.
Bring that with you ahead of time. And something else I was going to ask. Other tips or certain things that the navigators run across, common problems that people have, or I wish people knew?
The big thing, once again, is that the open enrollment period has changed yet again. And like anything that's web-based, the closer you get to deadlines, the more bogged down that system gets. So the sooner somebody can apply, the much better. The sooner that they can go in and at least create their account, get their information in there. That's not to say that on the same day you meet with a navigator, if you do it November 2nd, that you have to decide right then and there. No, I mean, you technically have until January 31st. But the closer you wait to that January 31st, the more potential there are for glitches.
I remembered my other question. Pre-existing conditions. That's always been an issue for somebody who was kind of going out there, well, for any kind of insurance, but especially for somebody who was going out there on their own to buy their own insurance. And that was one of the things with the marketplace insurance, was that was kind of not going to be an issue. Is that still the case?
Most definitely. Pre-existing conditions play no factor into it, which is nice. And then even in terms of calculating what your premiums are, literally, they don't ask for any health conditions. They're going to ask your age, your sex, and if you're a smoker. Those are the only things that are going to really impact what your premium is. You know, so it doesn't matter that you've had congestive heart failure. It doesn't matter that you have diabetes. All of that stuff is not even taken into account.
And is the same true with Medicaid? Do they ask any? I mean,
Oh, no.
That's
No,
not
yeah, the pre-existing doesn't matter.
Okay, all right. Does Medicaid have networks also, certain physicians or hospitals or labs or whatever?
When somebody qualifies for the Medicaid expansion, depending on what county you're in, there are different managed care plans.
Okay.
So once you apply and you get your approval, I think they give you 30 days or 60 days to pick a managed care plan. And all you have to do is call the state number, tell them which one you're picking. The thing is, though, is if you don't pick one, you're auto-assigned one.
Which might not be the one your doctor...
Exactly. So once again, you know, it's do your research, figure out, you know, of your providers, of the hospitals, all of that, who takes what. You know, but navigators can help with that.
So they have, once they sign up and they pick what kind of a plan they want, then they have a little bit of time to choose what network or what provider? Is that?
But they're going to pick a managed care plan, so it's like Buckeye, Molina, Paramount, whatever. You know, so they're going to pick one of those, and if you don't, the state just picks one for you. If that happens, that the state picks one for you, you only have 30 days from the point they pick it to say, no, that's not the one I want this. If you don't, you're locked into that until your next renewal.
Which could be unpleasant.
It could be. It could be. It could create other barriers, like, you know, the situation down in Findlay, and having to go all the way down to Lima, Allen County to get medical or hospital
So that
services.
would be the time frame you want to call your providers and say, I'm going to have Buckeye Medicaid or whatever. Is that what you take to make sure that that's the one?
Or just call them and ask them which of the Medicaid managed care plans do they accept.
Do they accept? Okay. Because that could change every year also.
Exactly.
Premium ranges for marketplace insurance, the different levels, is there kind of a range? I mean, it's probably, because you said the catastrophic, the premium is low.
But huge deductible.
Huge deductibles.
You know,
so
and
I'm sure the range is probably...
And it's all individual based. It is truly based on, you know, the county you live in, your exact household income. You know, so you can't go under the assumption, well, my neighbor, and it's just her and her husband, they got a plan where their premium's, you know, $80 a month, and I'm married, and, you know, it doesn't work that way. It is a very almost scientific calculation because it looks at everything in terms of calculating it.
Okay, so the range could be $5 a month to $1,000 a month.
I'd love to see one that was $5, but you know, but there is a huge spectrum in terms of the different monthly premiums, and it all depends on if you're doing a bronze plan, a silver, a gold, a platinum. You know, and that's all things that the navigator can assist individuals with.
And we're going to put numbers up and things like that for the navigators, because that's kind of the bottom line of talking about all this, is that it is super confusing. I mean, I have seen you present and talked with you many times, and still I don't get things. And so it's very confusing. And so to have somebody that can sit down with you face to face, do they do things over the phone also?
Generally, yes. I mean, we don't like to make that the norm because, you know, we definitely want to know that we're talking to who we think we're talking to.
Right, that's true.
You know, but nothing has to be completed that first appointment. We've had many people that have had 3, 4, 5 appointments with the same navigator just to make sure that all their questions are answered and, you know, that they're making the most informed decision that they can for themselves and their families.
Okay. Do people get a lot of things in the mail, email? I know with Medicare Part D, I said, just bring everything you've got in the mail, just bring it in, we're going to have a little bonfire. Are there things going out in the mail for those?
Definitely for Marketplace. You know, if you, say in the very first year you had insurance X, and then this current year you switch to a different one, you're going to get information on all of them.
Okay.
But the biggest thing to keep in mind is that you have the ultimate power to change whatever plan you have during that open enrollment period. And you don't want to be locked out of making a decision by waiting until after January 31st.
Okay. So meet with the navigator.
Meet with a navigator.
All right, thank you. We're going to take another break and we'll be right back. And we're back. I want to thank Julie for being our guest today, taking a lot of confusing information about market-placed insurance, Medicaid expansion, and really kind of clarifying a few things and letting us know the resources out there, which you can access by calling United Way 211, 800 number, websites, lots of ways to get in touch with a navigator who can help you simplify some of these things. If you ever have feedback about a program or a suggestion for a future episode, please let us know by sending a note to Time for Health, 615 Fulton Street, Port Clinton, Ohio, 43452, or email Carla Pelz at the high school, cpelz@pccsd-k12.net. So think about all the things you learned today. Share it with somebody, either for yourself or share it with somebody that you know. And until we meet again, I encourage you to make time for health.